Hello fellow doctors, preparing for the interview of UPSC CMS 2024. Let me tell you something. It's nothing new. It's just like your final year Viva practicals where you have to mug up everything on the last day before the exam and spit it out in front of your examiners. Just like you would have mugged up all those examination thick practical books, the same way you have to mug up all your thick notes, whichever source you would be following from the past 1 or 2 years, mug them up, cram them up and just spit it off in front of the examiner. There is no need to feel that simulating environment like it is for the civil services aspirants. If you are thinking like that, I have two questions for you. First, if it is just the theoretical knowledge, then why is the interview there? Why it is not the second stage of your written examination? It could be like it is mains for the UPSC civil services examination. My second question to you is, then why is an IAS or a retired UPSC commissioned officer there along with the doctors? Is he there to check your medical knowledge who himself hasn't done MBBS? Let me clarify things and let us decode whatever is important for the interview of UPSC CMS 2024. Hello everyone, my name is Dr. Kashyap Rastan. I am a doctor by profession currently working in CGHS Jammu, and I welcome you all to our channel Doctor Simplified. Let us understand how does an UPSC CMS interview looks like, how does it feel like to be in the UPSC Bhavan through my eyes. It was around the first week of October 2023, the last year. So when I reached the UPSC Bhavan, there was first the security check in the front gate. They would check you thoroughly and then let you inside because there are high personality and it is a very high secured zone. After you get inside the UPSC Bhavan, you have to submit all your belongings such as your phone and other things which you are carrying in one of the rooms, and in another room there were like chairs which were placed in a queue. You had to sit in one of those chairs you would be allotted, and those queues were actually the chamber numbers in which you would be allotted later on. So I was made to sit in the front chair of one of the queue of chairs. That means my turn was the first of that day. So there was a form which was given to me where I have mentioned it before in the videos that I had to mention my basic details in that form and tell about my preferred places of work where I would be like to post it when I would be selected for this exam in case of that. So as soon as I filled that form, I told you my turn was first. So I went inside the chamber. Let me tell you, the interview exactly looks like what you would have seen in those movies, and it has been around 1 year now and I still remember each minute of that interview. That interview of mine lasted for around 50 or 55 minutes, and yes, it was a memorable day for me. As soon as I went inside, with all that heart racing, that sweat, that nervousness, that anxious state of mind, I saw in the middle there was a retired UPSC commissioned officer, and there were other medical specialists or the professors as well who were sitting like in a round table corner meeting which you would have seen in your movies. It was exactly the same. So I was asked to sit down. You know what the first question by the IAS officer was asked? The first question was, what is my roll number? I knew this was my roll number, that UPSC roll number. And the second question was, so Dr. Kashyap, can you tell me what is the full form of pH? Do you know what is the full form of pH? We say that the pH of water is 7, the acid is less than 7 and the base is more than 7. What is the full form of pH? You don't know. I didn't know that. So in which of the sources you would have written for the past 1 year or 2 years? In which of these sources it is written what is the full form of pH? I was even asked what is the full form of pKa and the definition of both pH and pKa later on. So do you think these are the kind of question your final year Viva person would ask and would mark you on that? I don't think so. And why would an IAS officer ask me this? Okay, so I understood that I had already prepared for the mock interviews a lot of time, and I just knew if I don't know the answer, be polite, stay with a happy face and calmly say, "Sir, I'm not able to recall," or "Sir, I don't know." It's okay. Then he asked, "What is the pH of all the body fluids, including the gastric juices, the urine, the semen, the saliva, and what is the physiology behind it?" The IAS officer asked it. He didn't knew the answer exactly, right? He even didn't knew the answer. You might be knowing the answer, or you might be knowing the answer, but how would you expect someone from another profession ask you a medical question and mark you on the basis of that? So I will tell you the conclusion of this interview as well in the later part of the video. Let's continue further. So after a brief discussion with him, why I didn't do any job after my internship, I said I was preparing for my exam, for the CMS exam and all. Then came the surgery professor first, who was sitting on the left side. Fluids including, remember, he asked me, there is a scenario. There is a trauma patient who is lying on the road and he has been injured by the wheel of a truck. What would you think of in this patient? So it was just the crush injuries and the trauma management. It was exactly like that. Okay. Everything was like that. Stages of shock, management of shock in each stage. The answers expected were that. Then came the medicine faculty. So, you know what was the first question the medical faculty asked me? "Kashyap, where is UPSC Bhavan?" I told, "Ma'am, in New Delhi." She told, "Yes, in New Delhi. What are we seeing right now in these days?" I told, "Ma'am, maybe some more cases of COVID." She told, "Yes, there may be cases of COVID, but what else are we seeing now?" So October, November, it is around a time for dengue. So she was expecting the answer of dengue. I was not able to answer that, and I just told, "Ma'am, I am not able to recall at the moment." And she told, "It's dengue." So she asked me, "What is dengue? Is it a virus, bacteria? What is it?" The second question which she asked was, "What is the incubation period of that dengue virus and what is the critical period?" Thank God, a year or two before that I had suffered from dengue and I read everything about dengue from that time, and I was able to answer, and she was pretty impressed by it. Let me tell you what that stress, that why you need mock interviews. She asked me, "How many serotypes of dengue are there?" I answered that. Then she asked me, "Which serotype of dengue is dangerous? Is it 1 or 2? I told her, "Ma'am, it is the second serotype." You know what was the first thing she told me? She was lying back on the chair aram se. Now she came ahead in front and she told me, "No, you are wrong. I'm giving you another chance. Answer me, which serotype of dengue is more dangerous? Is it 1 or 2? What will you do now?" You would feel that, what have I done? Am I wrong? There would be thousands of questions which would come into your mind. But I was taught and I had learned that I have to be calm and composed. I told her, and believe in myself as well. I believed in myself. I told her, "Ma'am, it is the second serotype." She told me, "I'm giving you the last chance. Tell me the correct answer. I'm telling you it is wrong." I still stood by. I told, "Ma'am, it is the second serotype." You know what she did next? She looked at the surgery professor. She told, "He is the one and only student who is answering the second serotype." And they both laughed at me. The panel was laughing at me. How much of a low self-esteem or low confidence you would feel like when the interviewers are laughing at you. Let me tell you the real thing. The answer is second serotype. So it is not just the theory to mug up, it is the confidence which you need to have. It is the belief in yourself you need to have at that precise moment. And other questions she asked me, like, complete about pyrexia of unknown origin. 2 days differential diagnosis, 1 week differential diagnosis, 1 month differential diagnosis, rheumatological diagnosis, or you would think of cancers and everything she asked me. I was pretty okay in her interview. Then came the OBGYN. Now listen to these kind of questions. She told me, "Kashyap, have you worked in the labor room?" I told, "Yes, ma'am." "So what were the most common cases which you have encountered?" I told, "Ma'am, I have worked mostly in the HRP labor ward and I have seen pre-eclampsia and eclampsia as well." She told, "Oh, you have seen eclampsia. Now I am giving you one case scenario. Now listen to this scenario. One patient is coming to you, she's a pregnant female, she is coming to you and she is throwing up seizures. What are you going to do? I told her, ma'am, I would check up the vitals, I would check the blood pressure as well of the patient. I would, if it is more, I would think of pre-eclampsia, induced eclampsia, and or simply eclampsia, and I would take action according to that. She told every vitals are normal. SpO2 is 98, heart rate is normal, BP is 110/70. What are you going to do? I told her, ma'am, I would still consider to talk to the family members and let myself know if she is already a case of epilepsy. She might be a case of already a case of epilepsy who is on medications right now. So I told ma'am this. She told me, now let me give you a scenario. You is working as a UPSC officer, and there is one you are working in some rural area as an officer, and this lady comes to you. There is nobody, you are not even in your hospital, there is nobody, there is no staff, there is no nurse, there is no family, there is no drug, there is nothing with you. You don't have any medical facility available with you. What are you going to do? I told ma'am, I would like to secure the airway first, like we have learned the protocols, right? Airway, breathing, circulation in all these cases. She told, good. How would you secure the airway? I told ma'am, I would use the oropharyngeal or the nasopharyngeal airway, preferably oropharyngeal. So she told me, I told you before, you don't have any medical facility, no medical equipments, nothing you have. What will you answer in this? I was completely clueless. You know what the answer was? The answer was, you would take a spoon, you would, a spoon has two surfaces, one convex and another concave surface. You would put the spoon in her tongue, on her tongue, and you would retract from those spoon. Which coaching notes tell you to answer all these? Please let me know in the comment section. So it is all about, giving you scenarios. I just felt like my mind was the most consumed in those 50 minutes. They made me think so much I have never thought before with my mind. So after she told that you would take a spoon and retract the tongue through it, so I was pretty confused. Is it the actual answer, or is it something that she's trying to play around with me so that my confidence is even more broken down, and then that would be the point to test me? So I just smiled at the professor and I told her, thank you so much, ma'am, for the answer. And after all of it was done, the IS, the officer, he asked me, so tell me, you get a selection in your postgraduate examination as well, along with UPSC CMS. What are you going to do? These are the kind of conflicting questions which test your mind. He has been interviewing students for the past, I don't know, to 20 or 25 years, and he's testing you. So he knows what are you going to think. I told ma'am or sir, I would go for the post-graduation. So he told, then why you are here in the interview? I told ma'am, I would go for the post-graduation after 3 years. I would go for the post-graduation after completing my probation period, and in the 3rd year I would go for the post-graduation through CMS itself. And they were pretty happy, because a lot of aspirants, they just simply go and they don't know what all are the processes of the CMS. So when you tell that you get a leave in around 3 years and you can pursue your post-graduation, they understand that yes, you are a student who knows about the gravity or the depth of the CMS and what all opportunities it gives. So it was a positive thing, which I think I left on them, the positive impression. There were other here and there questions as well, which I'm not able to completely recall. So it was all in all a mixture of everything. It was not just one source cramming up. If I would have crammed everything and all the notes, I don't think I would be able to answer even the first question and the related questions, because all of them were just the bouncers from the definition of pH, from the dengue serotype when they were mocking at me, or when the ops kind of the spoon question. They would have been the bouncers, and it would have made me so underconfident that I would have even not been able to answer the other questions as well. So it is not just your clinical theory knowledge, it is your presence of mind, your humbleness, and everything everything you prepare a day before of that interview. Your mentality, how do you feel emotionally, how do you feel within you, do you feel confident of your own knowledge? So it is all about that and not just your cramming up thing. So I think I did fairly well enough during the entire 50 or 55 minutes of the interview process. And what helped me the most was not cramming up my notes again and again and again. It was actually attending the mock interviews and the mock sessions. I had attended, don't know, n number of mock interviews and sessions in which there was the same kind of simulations and there were exactly such kind of questions which came, and I didn't knew the answer of them exactly, and I exactly had a feeling of what I would feel during the actual interview process in the mock interviews itself, so that I don't do the same mistakes in the mock interview. And what helped me the most was hands down to the mock interview sessions which were conducted last year. Many students of my own 2023 batch had given these mock interviews and many have secured very good marks in them. 60, 65 easily people have scored in them, and I was in the similar range as well. So yes, mock interviews are very important. In the description section of this video, I have given the link to join the Telegram as well as the WhatsApp channel of this group, the mock session group, which is currently going on for the CMS 2024 as well. Trust me, more than anybody reciting their interview stories, it is the best to one-on-one feel the presence of that mock interview sessions with your mentor, because that helps you the most. Maybe your theoretical knowledge, maybe your clinical knowledge, or maybe your presence of mind and feeling of that low confidence during those interviews, and then getting back on track. With each mock sessions, you would definitely improve, I'm very sure of, because I improved a lot through them. The links to those groups are already added in the description section. Do check them out, contact with your mentor, and shine in the interviews as well, because interview is equally important as your theory. Thank you so much for watching this video. Stay tuned with Dr. Simplified.